1 in 4 of us here in this room will be above 65. And unfortunately, I'm one of them. There are obviously multitude of different measures undertaken, right, over the last decade, yet we continue to experience this double-digit medical inflation. Why are the current measures ineffective?
In Singapore, right, the Health Science Authority in 2024 approved 50 novel drugs. Can you imagine from 2022 to 2025? It's definitely more expensive, right? Because you have something new in the market, people want to try. As human beings, we want to live better, live longer. So the increase is about 23%.
The one lesson is there must always be skin in the game for everybody, including the individual co-payment. Okay? If that co-payment proportion becomes excessive that they cannot afford, then you come in with additional support systems. But as a principle, co-payment is 100% essential to influence and incentivize good behavior.
We can do as an industry is be as transparent as possible, because I think unless you share information, unless you put information on the table for people to digest, the only issue is whose responsibility is that?
Sure.
And that gets to be an issue. So the insurers are really looking at their own data, trying to manage cost.
Yep.
But the challenge, and it goes back to value-based healthcare, is we know what the costs are, but what does good look like? And that gets more difficult.
I would encourage all insurers and administrators to use clinical pathways. Those are effective tools at looking at medical necessity, particularly for hospital admissions and length of stay. That is a good system of checks and balances for what's being done in the current marketplace.